committee started. All right. I want to thank everybody for being here at the House Committee on Health. I first wanted to recognize our House Sergeant at Arms, Terry McCraw, Nina Lage, there she is, Statford Young, and Todd Jordan. Thank you very much for being here. We have a couple pages. I have a Jamie Chang, Representative Cervania. Stand up, let us all see you. Anna Ferrario from Speaker Hall, and Jesse Pollard, Representative Brown. Very good. We have a number of bills today. We're going to try to get through them efficiently. So be moving right along. First bill up is there's a proposed committee substitute for House Bill 512, and without objection, we will have that before the committee. Representative Gillespie.
Thank you, Mr. Chairman. Good morning, committee members. House Bill 512 is a bill that would allow emergency personnel to render emergency services to an injured canine. That's all it does. It's a very simple bill. I've run other bills that are designed to take care of the animals that take care of us. And this is just a continued effort to do that. I'd ask for your support and stand for any questions.
Any questions? Nope. Waiting for a motion. Go ahead, Representative Campbell.
Mr. Chairman, I would move for an unfavorable review to the original bill, favorable to the amended bill, and referral to Judiciary 1.
It seems to be in order. All in favor, say aye. Aye. All opposed, say no. In the opinion of the chairs, the ayes have it. The ayes do have it, and we will.
Thank you.
All right. Next up is House Bill 390, Alleviate the Dangerous Surgical Smoke, and I think Representative Cunningham. You've done a nice job, so there's no PCS today, the original bill.
Thank you, Mr. Chair. First and foremost, I would like to thank my primary sponsors, Representative White, Representative Blackwell, and Representative Rita. House Bill 390 establishes standards for surgical smoke evacuation in hospitals and ambulatory surgical facilities, requires licensed hospitals and ambulatory surgical facilities to adopt and implement policies that require the use of smoke evacuation filtering systems during any surgical procedure likely to generate surgical smoke. Surgical smoke is caused from burning human tissue in operating rooms across North Carolina. It contains hazardous chemicals that harm everyone in the operating room: nurses, doctors, technicians, and patients. 17 states have now mandated surgical smoke evacuation. We passed this bill in the House almost unanimously with only 2 no votes. I do not know of any opposition to the bill.
Any questions? Representative Campbell.
I think the answer to this is yes, but
Recognized for a question.
I'm sorry, Mr. Chairman. The handheld Bovie cautery device that has the incorporated suction into it, would that satisfy this bill under how it's written?
It would, Dr. Campbell.
Thank you, Mr. Chairman. Thank you.
Any other questions? Representative Potts for motion.
Thank you. I move for a favorable report to House Bill 390 with a referral to rules.
All right, we have a motion. All in favor, say aye. Aye. Opposed, say no. In the opinion of the chair, the ayes have it. The ayes do have it, and it will be referred to rules.
Thank you, Mr. Chair.
All right. Next up, we have House Bill 612, the Fostering Care Act. Representative Chesser. You have the floor to present your bill.
Thank you, Mr. Chair, committee members. First, I'd like to thank my colleagues and co-sponsors and colleagues in the Senate and colleagues across the aisle. This has been a long time coming. A lot of work has gone into this bill. It's a much needed reform. For a long time, we've all recognized that there's an issue with our foster care system. And so I'm hoping that this cycle, we can actually move the needle for the kids that need it the most, when those are the kids that are involved in the foster care system. I want to make clear that this bill, again, we are not focused on punitive action against bad parents. We are focused on improving life outcomes for children that find themselves in the foster care system. And to that end, there have been a lot of compromises made from all stakeholders involved. It's not a perfect bill. No one got everything they asked for, and there's still a lot of work to do, but it is a move in the right direction. I know you guys got a lot on here, so I don't want to go through sections because it's a 28-page bill. I would just say that we put a big focus here on increasing accountability, being able to actually hold people accountable, make sure that kids are being placed in licensed facilities, and establishing parental rights, making sure that, I think it's important for people to understand, as far as government goes, the removal of someone's child is one of the greatest takings, as a legal term, that the government can embark upon. It's extremely consequential, and I think it should be measured with protecting parental rights and individual rights and freedoms. And so we made sure to focus on that in this bill as well. You will find that there's a portion in here where we're establishing a process by which a father can petition to reinstate parental rights. That is not a flaw, that's a design. We know that statistics prove that when fathers are involved in children's lives, the outcomes are generally positive. And so we want to make sure we preserve that, and due diligence is given to making sure that a father who finds out he is a father has an opportunity to get involved. And so that's one of the big provisions that we have here. Make sure that there's timely assessments, there's conflict resolutions in here. We're focused on creating permanency. We recognize open adoption contracts for the first time in North Carolina's history. They're in common practice now, but they're not legally enforceable, so we're giving them some teeth so that they actually can stand up in court. And I'll just stand for any questions of that. There's a lot that this bill does, but I appreciate your support.
Any members of the committee who have questions? Representative Chester, you've done some great work. We do have a couple people who, from public comment, so unless there's anything from the committee right now, I have two people who spoke, Paula Reinhardt and a Britton Wright. And so if you'll come to the podium, identify yourself, and you'll have 1 minute to speak.
Yes, I am speaking as a social worker in Wake County of 25 years, but more importantly,
Please identify your name, ma'am, and if you're
Paula
with a group.
Reinhardt.
Okay. And if you're with a group.
I'm not with a group. Yes, and I have published and written on the subject of foster care for an interview for at least 5 years because I have 4 adopted grandchildren. I care deeply about the subject matter. There's much in this bill that is really encouraging. I was encouraged to see things that move toward permanency. I want, as I have written about it, foster care parents call me from around the state. We are recruiting in our churches broadly for foster care parents, but you know what they say privately? They say, I'm not doing that again. I cared for this child for 2 years, and the mother really wouldn't get into drug treatment. I had no voice in what happened to the child. I wanted a child, hand back a child that I loved for 2 years to people I knew would not care for him. So the moves in this bill to permanency are encouraging, and we need child-centered attorneys in the state like 10 other states have. Thank you.
Britton Wright.
Thank you, Mr. Chairman. I'm Brenton Wright from Greensboro. I practiced adoption law for 35 years. I have been the chair of the board of Children's Home Society. I have been the chair of the board of North Carolina Right to Life. I have been the co-chair of the adoption committee of the family law section of the Bar Association for many years. I'm here on my own account today and want to comment on sections 14C and 15A of the bill found on pages 15 and 17. The critical time when a baby's mother and potential adoptive parents must decide whether to go forward with an adoption is near or at the child's birth. That's when potential adoptive parents need to be able to determine how likely it is that their adoption can be completed. Our present law allows for this. However, sections 14C and 15A would push that determination way out and would discourage adoptions. Thank you, sir.
Thank you. Any other questions from the chairs or from the committee? Seeing none, Representative Loftus is recognized for a motion.
Thank you, Mr. Chairman. I move for a favorable report on the bill and with a referral to Judiciary 2 if favorable to Rules Calendar Operations of the House.
I think it's going to be Judiciary 1, if I'm correct.
I will amend my motion to Judiciary 1.
All right. All, if hearing the motion, all in favor say aye. Opposed, say no. I think in the opinion of the chairs, the ayes have it. The ayes do have it, and it is moved on. Thank you very much. All right, next up, we have a PCS for House Bill 412, and without objections, we will consider that before us now. I think Representative Arp, you have the floor.
Thank you, colleagues, and thank you for allowing me to present this bill to you. I'd like to recognize my colleagues and co-sponsors on the bill, Representative Lambeth, Perret, and Ryan. And definitely we've been working on this child care. This is one of 4 bills that Representative Lambeth and I and our team have been working on. And if do you want to say anything or kick us off? Or
the only thing I would add is that we've got a problem in North Carolina with child care and child care subsidy. So we've been trying to focus on this for a while now, trying to figure out are there things that we can do to increase the number of slots, as well as to try to, quite frankly, minimize the subsidy that the state puts in to keep some of these going. But we have a major problem. I think the things that we are trying to do right now are steps in the right directions, and we've been negotiating with HHS to try to get to the point we need to get to, and I think we're almost there, but we continue to talk to HHS on ways that we can continue to improve in the area of child care.
And so some of the folks that we've been working with and are supportive of this bill is the North Carolina Licensed Child Care Associations, the community colleges, the Chamber, the Partnership for Children, the North Carolina Home-Based Child Care Initiatives, and the YMCA's, Alliance for YMCA's, as well as the department, as Chairman Lambeth said. What this bill does is, at its core, is try to increase the number of slots and attempts to lower the costs and simplify licensure. It does three things. We want a child care system that is safe, affordable, and available. And so we approach that by doing several different things. We want to reduce unnecessary regulatory burdens on the child care providers to lower their cost, in hopes that that lowers the cost to parents. And then we also focus on increasing the workforce supply. This bill, along with House Bill 389 and 309, attempts to streamline the credentialing process. And to give you an example on some of the regulatory reform, you've got kids who go to school in public elementary school, but there are different requirements if you have a daycare center or an after-school setting in the same facilities. And so what this bill does as part of that is just says, look, if it's good enough for them to be in it for 7 hours, it's good enough for them to be in after school as well. And so this bill clarifies that. It's got a lot of other stuff, and I'll instead of me just going through it, I'll stand for any questions.
Representative Crawford?
Thank you, Mr. Chair. Just a couple of comments and then a question, I think, for the bill sponsors.
Okay.
Great. Well, thank you for working on this and for acknowledging just the critical situation that we're in with our child care facilities with accessibility and affordability. And I want to also thank you for the changes that you all made from the original bill to the PCS. I think it is much improved. I do want to just point out, I do have some concerns about this idea of decoupling QRIS rating system with the subsidy calculations, just related to de-incentivizing quality improvement, potential unequal access to quality, and then just the transparency and accountability that comes with that QRIS rating system. And so thank you for your work to, rather than make that a must-do right out of the gate, for the work that you did to make that into a study for DHHS to complete and then come back with recommendations. But I do have concerns about that. Just one question. I noticed that section 7B on page 5 had changed a lot from the original bill that was filed, and I'm just curious on this question. I have a question on the use of the word "or" on line 19 of page 5 regarding the qualifications. Does that potentially put us out of compliance with that block grant funding?
I don't think so. I think one of the things you do there is to align the federal requirements with what our state goes beyond some of those requirements, and there's a thought that there can be some cost savings by making sure we don't outrun where some of the requirements go.
Follow up?
Go ahead.
Thank you, Mr. Chair. So just on this, if the block grant requires all of these various things, but then we're saying or hold an early childhood credential, I just want to make sure that that's consistent. And would you be open to just further discussion on that?
Certainly, we're trying. Nobody's wanting to imperil federal monies coming down, for sure.
Great.
But we can't keep doing the same thing and not expect a different outcome on the thing.
Absolutely. I do think I would be interested in more conversation about that, and I appreciate you being open to it. Thank you.
If fiscal staff would be able to help shed some light, we appreciate that.
Luke McDonald, Fiscal Research Division. I'll note that the early childhood credential is a state credential, and it's kind of what's already required. I would expect that is all the federal regulations with CCDF would be encompassed within that.
Representative Cervania.
Thank you, Chair. I'd like to ask the bill sponsors a couple questions.
You're recognized for a series of questions.
So we've mentioned federal and state, but there's also going to be a lot of responsibility now with the local DSS offices when it comes to the expansion of providers. Are we providing them any appropriation or provision to help support in this effort?
They're not directly, no. I think, can you help me understand
Sure.
why they're
and I might be misunderstanding in the bill, in that when we expand the range of providers, be it school-based, religious, family-based care, we want to make sure that there's enforcement when it comes to the health and safety standards, right? And so a lot of that comes on the burden of the local DSS offices. So do we provide any provisions in this bill to help them be successful in this expansion and make sure that we have high quality of care for our children?
The short answer is no, but that's, I hope that's a problem we all have, and it actually increasing slots. We're just not there. paramount. So health, safety, and welfare of the kids is paramount. Nothing in this bill changes that. But we hope to be successful with additional child care slots so that we can have a workforce that maintains the safety inspections and so forth like that.
Follow up. If there could be a consideration of provision to that, to explore what the responsibilities will be on our local areas and to make sure that we really do this right, because this is so important.
And I would ask staff if they could, because I'm not sure what she's referring to.
Debbie, do you want to speak first?
I think Representative Cervania may be talking about the inspectors and such with the county that goes in and make sure that the sanitation is where it needs to be, that the folks are on site that needs to be, that do the follow-up inspections. I think that may be who she's talking about. And so therefore maybe that they would have an increased workload as the slots increase. There would be more folks to inspect, I think.
Chairman, I would say we haven't had any feedback from the locals, and this bill has been out for a couple weeks, but we're open to hear from them or look at that issue if that may become an issue.
Representative Cunningham, you recognized.
Thank you, Mr. Chair. I got one question that I want clarity from, and it may have to come from staff, and that's the federal block grant requirements. The federal block grants, are they more stringent than what the states are, or ours are much better than the federal as far as the requirements and the guidelines that we have to stay within?
My short answer, Representative Cunningham, thank you for the question, is that as a generalization, let's say, we certainly comply with all federal requirements. We probably in some areas extend those on there. I hope that's a fair answer.
We recognize staff to weigh in as well.
Thanks. Luke McDonald, Fiscal Research. Representative Cunningham, are you asking about the question from earlier from, I think, Section 7, the early childhood credential?
I was specifically referring to the federal block grant as far as how we align.
Okay, thank you. Luke McDonald, Fiscal Research. Yeah, currently we're in full compliance with the federal CCDF block grant, and as far as I know, haven't had any issue drawing down any of those funds due to any out of compliance issues.
Any other questions from the committee? I do have one person who signed up to speak, Erica Simmons. If you could come to the podium, identify yourself and what group that you're from.
Thank you. I'm Erica Simmons. I'm representing the North Carolina Alliance of YMCAs, and we're just grateful to Representative Arp and his staff for all the work that's been done to make these changes in child care that will help us to overcome barriers and challenges to expanding access. And the North Carolina Alliance of YMCAs especially appreciates provisions of this bill that reduce barriers to opening school-age child care slots, giving out-of-school time programs options for assessing program quality. We've also been working with the community college system on revamping the educational requirements for school-age staff, and welcome the changes here that create a much-needed credential.
All right, seeing no further comments, recognize Representative Potts for a motion.
Mr. Chairman, if I could if I can make one comment, because it was brought up, and it's indirect, but I think you need to be aware of it as a committee, and that's the federal block grants. The state receives about $500 million, is my understanding, from the federal block grants. If somebody's here from HHS, if they nod their head, I think that's about right. And we are concerned, I think the work of this committee that we've had kind of working on this is very timely, because that money is at risk. And if that money starts going down, then we've got to be able to either move along a little quicker or put more state money into it if we're going to keep things at a similar level. But I thought it was important that the committee understood that the federal block grants are at risk, and there's a lot of money that comes down to the state for those child care centers.
Thank you. Representative Potts.
Thank you, Mr. Chair. I move for a favorable report to the proposed committee substitute on House Bill 412, unfavorable to the original with a referral to Judiciary 2.
I think that's one also went to Judiciary 1. We're going to create more work. I know. We're going to extend it to 1.
I'll get to hear it again.
Yeah. All right. The motion's before the committee. All in favor, say aye. Aye. All opposed, say no. In the opinion of chairs, the ayes have it. The ayes do have it, and it will be moving along.
Thank you very much.
All right. Next up is House Bill 485, Adult Care Medicaid PCS coverage. And I think... Okay, Representative Potts. Representative Chair.
Thank you. We've probably all in our districts in one form or the other run across individuals, our constituents, who are just a little over the income level to achieve the special care assistance. And I know in my county, when I was chairman of the commissioners, we had a lady who had $3 over and she couldn't receive the care she needed. So what this bill does is propose an increase in the percentage of the poverty that their income can be and still qualify for special state assistance. This should cost no more money because people who fall into that category are often moved from assisted living into nursing home, which is a lot more expensive place to keep our families. And so I ask for your green vote on this, and thank you very much.
Any questions from the committee? Representative Crawford, you got to give him some grief.
Well, I'm going to try very, very hard, Mr. Chair. Just a question and maybe a comment afterwards.
You go forth.
Thank you, Mr. Chair. Representative Potts, am I correct in seeing that this potential extension of coverage applies to those who reside in licensed adult care homes only?
They don't if you're talking about in-home care, the answer is no, not yet, but we're looking at that.
Okay, well then just a comment.
Go ahead.
Thank you, I appreciate that, and I think, I would be interested in seeing how the department might explore. I know that it becomes a lot more complicated to provide in-home personal care services, but how to explore how that might be done, and of course the costs associated with it. So thank you for being open to that, and I'll do a motion at the appropriate time.
Other questions from the committee?
I have just a comment. Representative Crawford, I took that as you were scared that I was commenting, weren't you? I take that as a volunteer to serve on that committee.
So moved.
You've got another voluntold. All right. Seeing no other comments from the committee, recognize Representative Crawford for a motion.
I move that this bill move forward. I don't know how to say all the words the right way, so I'll refer that to you, Mr. Chair.
I think you want a motion for a favorable report for House Bill 485 with a referral to Judiciary 1.
That's exactly what I meant to say.
I thought
Thank
you did. All right. All in favor, say aye. All opposed, say no. All in the opinion of the chairs, the ayes have it. The ayes do have it, and it will be referred on. Creating some work for Judiciary 1 today. All right, next and final, we're going to hear a PCS for House Bill 565, and without exception, we will hear that the check yes, save lives.
Appreciate it, Mr. Chairman and members of the committee. What House Bill 565 does is allow resident taxpayers to enroll in the organ and tissue donation program via their income tax return. So when you do your taxes, you're asked if you would like to become a donor or not, and also brought Representative Shepard with me today to add a personal touch to it.
Thank you, sir. Some of you may know this, some of you may not know it. In 2017, I had a kidney transplant. If not, I probably wouldn't be here today. So this is near and dear to my heart, and we have thousands of people in the state of North Carolina today that are awaiting kidneys and other transplants. So any avenue that we can open up as an opportunity for more people to be willing to donate is a plus. And so I really appreciate your yes vote on this bill.
Representative Campbell.
Motion at the appropriate time, Mr. Chairman.
Other questions from the committee? All right. Representative Campbell, I'll recognize you for a motion.
Mr. Chairman, I move for an unfavorable vote for the original bill and a favorable vote for the supplement with referral to state and local government.
That does appear to be in order. All in favor say aye. Opposed say no. In the opinion of chair, the ayes have it. The ayes do have it. And thanks very much. Very efficient committee this morning. I want to thank our staff for all the great work to get ready. This committee is adjourned.